Let's talk about something every parent dreads, ear infections. There are two main types. The first ear infection is called the middle ear infection or otitis media, which is the most common. It happens when fluid builds up behind the eardrum, usually after a cold. Then the second type is called an outer ear infection, commonly what we think of as swimmer's ear. That comes from when water gets stuck in the ear canal. So why do kids get ear infections more than adults? It's all about the anatomy. So children have shorter, more horizontal eustachian tubes, which are these little drainage pathways from the ear to the back of the nose. Normally, that little hallway is open and allows any fluid to drain back into the nose and be cleared out by the child. However, when a kid's nose gets stuffy or congested, those little tubes get really swollen too, and it traps the fluid and bacteria in the ear, causing a middle ear infection. Common reasons that little noses and eustachian tubes get stuffy are viral infections, swimming or dunking your head underwater, allergens in the air like pollen, smoke, and dust, and changes in altitude like going up a steep mountain or flying in an airplane. To help prevent ear infections, we can keep up with routine vaccinations, including the flu shot every year, avoid secondhand smoke, and control the allergens in the home and the child's environment, such as dust, pet dander, and pollen. And if your child has allergies, make sure that they're taking the appropriate allergy medicines like antihistamines or steroid nose sprays. And something I always tell my patients in clinic is to fix the ears, we have to fix the nose. So if congestion is a main contributor, relieving the congestion is key. So using a humidifier, steam showers, lots of saline nasal sprays, and drinking lots of fluids are really important. And then for older children, encouraging blowing their nose and helping pop their ears to help pop those little tubes open. And if your baby is bottle feeding, try to keep them upright. That also prevents milk from refluxing and going back into the ears too. If your child gets an ear infection, don't panic. They usually will resolve on their own in a couple days. But if you have any worrisome symptoms like fevers, the pain is worsening, the child's complaining of headaches, is vomiting, or having trouble feeding, please check in with your pediatrician. Sometimes we'll recommend antibiotics or pain relievers to help clear the infection. Ear infections are common, but with a little knowledge and care, they don't have to be a big worry. Thanks for watching.